Good afternoon, and thank you for joining the daily briefing on the City of Philadelphia's response to COVID-19. Today, all speakers are joining the briefing virtually to adhere to social distancing guidelines. We will begin our briefing now with opening remarks from Mayor Jim Kenney. Mayor, you now have the floor.
Thank you very much. Good afternoon, everyone, and welcome back from the holiday. Today, I want to remind residents of a very important deadline coming in just 4 hours. It's 4 hours. That's right, 4 hours from now, 5 p.m., brings the deadline to apply for a mail-in ballot for the primary election on June 2nd. Because of the continued need for social distancing, conducting an election in person will present new challenges. There will be fewer polling places and fewer poll workers, and possibly long lines. So the best thing to do is to vote by mail. If you have not already requested a ballot, you can do so now by going to apps.philadelphiavotes.com. That's apps.philadelphiavote.com. Look for the button on that page that says mail-in ballot application. You will need your driver's license or PIN.ID number. Again, that's apps.philadelphiavotes.com. Although the polling places will be open on June 2nd, voting by mail will help reduce transmission of COVID-19 and reduce the number of voters gathering at polling places. But again, that deadline to request a mail-in ballot is 5 p.m. today. Don't put it off. And once you receive and fill out your ballot, you just have to drop it in the mail, or you can bring it to a special mailbox that the city commissioners have set up on the south side of City Hall, right near the Octavius Catto statue. Our corporate neighbors also continue to show generosity during these difficult times. This past week, we received a huge donation from American Airlines, who delivered pallets of juice, snacks, and PPE. This is greatly appreciated because, as we have seen, the pandemic has increased the vulnerabilities of many residents, and that in turn has placed great strains on social service providers here in our city. We thank American Airlines for their generosity. Finally, I want to share some encouraging news as it relates to restrictions on business activity. As we continue to prepare for a phased reopening with the expectation that our region will move to yellow on June 5th, there are some steps we can take now to begin easing restrictions while we remain in red status. Today, Dr. Farley and I signed an amendment to our current business activity and stay-at-home order that goes into effect immediately. The amended order will allow walk-up ordering at food service businesses, including restaurants and mobile vendors, allowing that activity to resume, subject to general social distancing requirements. Dine-in service is strictly prohibited, and face coverings are required at all times for walk-up ordering. Restaurants cannot permit lines of more than 10 customers to form in or around facilities. The amended order also includes relaxations on certain restrictions for construction and real estate activity. The scope of our April 29th construction authorization order will be revised to allow construction under building permits issued after March 20th. Our order has been updated to reflect Governor Wolf's determination on May 19th that businesses in the real estate industry can generally begin to operate throughout the state, as long as guidance to reduce risks in connection with such operations is followed. We thank the industry organizations who have worked with us to get us to this point and who will help ensure their members are informed and prepared to work safely. And with that, I turn it over to Dr. Farley for his daily update.
Thanks very much, Mayor. We're seeing more signs of progress today. From this time yesterday until today, we have 97 new cases of the coronavirus infection in Philadelphia residents, bringing us to a total of 21,738. Now, that 97 number is the first time we've been in double digits in weeks. It wasn't long ago that we were more than 500 cases a day, so that's a big decline from where we were. Now, there was less testing on Memorial Day that may reduce that number a little bit, but the trend is still clearly very much in the right direction. We're also seeing progress in our clusters in congregate settings. Our nursing homes are seeing fewer outbreaks. They're doing more screening of asymptomatic residents. In the city's jail, there are 0 new cases since this time yesterday. Now, they are also doing screening of asymptomatic inmates, and we expect to find some cases when that screening is ultimately compiled. The city's hospitals now, I think, are probably all breathing a sigh of relief. This morning, or yesterday afternoon, there were 439 coronavirus inpatients in Philadelphia hospitals and 891 in the Southeast Pennsylvania region. That continues to decrease, and we're now less than half of where we were at the peak of the epidemic. Since this time yesterday, I can confirm 8 new deaths from the coronavirus infection, bringing us to a total of 1,243 since the beginning of the epidemic, of which 662, or 53%, were nursing home residents. Again, that number is definitely declining, the number of daily deaths. Where testing is increasingly available, just remind everybody that we encourage anyone at any age with a new onset of respiratory symptoms to go in and get a test. So that could be a cough, shortness of breath, or a sore throat, or a fever, go in and get a test. And today we're adding one new category of people that can go in and get a test that we're encouraging to get a test. That would be anybody, even people who do not have symptoms, if they've got a known exposure to someone with the coronavirus infection or suspected exposure to someone with this infection at least 7 days earlier. 7 days is enough time for them to show evidence of the infection if they got it. By expanding this criteria, we hope to pick up additional cases that we're missing now. It might help us as we expand our contact tracing. It's part of our general relaxation of criteria as testing becomes more available. There are more than 50 sites, or about 50 sites, 50 sites in Philadelphia where you can get tested. www.phila.gov/testing is where you can get information about each of those different sites. Now, in general, we are still under the stay-at-home order today, but we are definitely getting closer to a stepwise, gradual restart of activities that were restricted in the past because our numbers are looking so good. As you just heard the mayor say, effective immediately, we are now allowing on-site ordering of food at restaurants and mobile food vendors. But just to be clear, that doesn't mean dining in, that just means you go there in order to take out. And we want to make sure that people are not clustering where they order to take out food. So no lines of more than 10 people are allowed. We're telling restaurants to encourage people to wait outside while they're waiting for their food, and everyone's going to be required to wear masks. This is what I consider to be the first step towards a new normal here. If all of our numbers continue to be good, we expect that Philadelphia will go to what Governor Wolf has categorized as the yellow phase on June 5th. That's if our numbers continue to look good between now and then. Later this week, we hope to be releasing plan and guidance on exactly how we do that in a safe way. It will involve many differences from the way that people operated before the epidemic. The differences for businesses and differences for residents. It'll involve reducing the number of people in any one setting, involve barriers to block the droplets that might carry the infection from one person to another. It'll involve spacing of people, and it will involve masks. So the businesses are going to have a number of different restrictions that they're going to have to adopt in order to protect people. But the main thing that residents need to do is to think about masks. That's the one thing that's clearly under the control of every individual person in Philadelphia. Wearing a mask has to become the normal, expected behavior of what we do when we're around other people. That's the way we can restart our economy safely. So if you haven't done it yet, get a mask and get used to wearing it. More information about all the data I just showed and about the epidemic more generally is www.phila.gov/COVID. If you have medical questions, 1-800-722-7112. Thanks.
Thank you, Dr. Farley. We are now going to move to Armando, who will deliver the Spanish language translation of both the mayor and Dr. Farley's remarks. Armando.
Mensaje del alcalde Jim Kenney para el martes 26 de mayo del 2020. Buenas tardes a todos. Hoy quiero recordarles a los residentes que en menos de 4 horas se vence un plazo muy importante para nuestra democracia. Así es, a las 5 de la tarde se cumple el plazo para solicitar una boleta de votación por correo para las elecciones primarias del día 2 de junio. Debido a la continua necesidad de distanciamiento social, el voto en persona presentará menos desafíos. Habrá menos centros de votación y menos trabajadores electorales y posiblemente largas colas. Entonces, lo mejor que se puede hacer es votar por correo. Si usted aún no ha solicitado una boleta, puede hacerlo ahora mismo visitando el sitio web apps.philadelphiavotes.com, es decir, apps.philadelphiavotes.com. Haga clic en el botón que dice solicitud de boleta por correo y necesitará usted el número de su licencia de conducir o su número de identificación de PennDOT. Aunque los centros de votación abrirán el 2 de junio, la votación por correo ayudará a reducir la transmisión del COVID-19 y la acumulación de votantes en los lugares de votación. Pero repito, la fecha límite para solicitar su boleta por correo es hoy a las 5 de la tarde. Por favor, no lo posponga. Y una vez que la reciba y emita su voto, usted puede enviarla por correo postal o puede llevarla al buzón especial instalado en el lado sur del ayuntamiento, cerca de la estatua de Cato. Nuestros aliados corporativos nos continúan mostrando su infinita generosidad durante estos momentos tan difíciles. La semana pasada recibimos una gran donación de American Airlines, que nos entregó jugos, refrigerios y artículos de protección personal. Esta donación es muy apreciada, porque como ya hemos visto, la pandemia ha empeorado la vulnerabilidad de muchos de nuestros residentes y eso a su vez ha puesto bajo gran presión a los proveedores de servicios sociales en Filadelfia. La ciudad de Filadelfia le agradece a American Airlines por su generosidad. Finalmente, quiero compartir algunas noticias muy alentadoras relacionadas con las restricciones a la actividad comercial. A medida que continuamos preparándonos para una reapertura gradual, tenemos la expectativa de que nuestra ciudad pase a la fase amarilla el próximo 5 de junio, pero hay aún algunos pasos que podemos tomar ahora para comenzar a aliviar las restricciones mientras estamos todavía en la fase roja. Hoy se firmó una enmienda de orden que regula la actividad comercial y la permanencia en el hogar que entra en vigencia de inmediato. Esta orden modificada permitirá que se reanuden las órdenes para llevar comida dentro de restaurantes y otros establecimientos comerciales que venden alimentos, pero todavía respetando las medidas de distanciamiento social. El servicio de cena todavía queda estrictamente prohibido y se requiere el uso de mascarillas y cubiertas faciales en todo momento para realizar pedidos dentro de los establecimientos. Los restaurantes no pueden permitir que se formen colas de más de 10 clientes dentro o alrededor de su establecimiento. También esta orden incluye la modificación de ciertas restricciones para la construcción y la actividad inmobiliaria. El alcance de las normas para los trabajos de construcción del 29 de abril será revisado para permitir actividades de construcción relacionadas con proyectos para los cuales se emitieron permisos de construcción después del 20 de marzo. Nuestra orden se actualizó para reflejar lo anunciado por el gobernador Wolf el pasado 19 de mayo, autorizando la operación de las empresas de bienes en todo el estado, siempre y cuando se sigan las pautas para reducir los riesgos de contagio en relación con dichas operaciones. Les agradecemos a las empresas que han trabajado con nosotros durante esta pandemia y estamos seguros que nos seguirán ayudando para garantizar que sus trabajadores estén informados y preparados para volver a trabajar de una manera segura. Y esta es la actualización en materia de salud para el día martes 26 de mayo del 2020. Desde ayer se han confirmado 97 nuevos casos del coronavirus en Filadelfia y actualmente tenemos un total de 21.738 casos en la ciudad. Esta es la primera vez en semanas que anunciamos un número con solo 2 dígitos. Las cifras de hoy pueden reflejar informes retrasados durante el fin de semana festivo, pero la tendencia es muy clara. Hay una disminución en el número de los casos. También encontramos avances en la evolución de los casos en los entornos grupales. No tenemos nuevos casos del COVID-19 en las cárceles y actualmente reportamos 2 casos confirmados solamente. Los hogares de ancianos se encuentran realizando pruebas a pacientes asintomáticos. Sin embargo, se espera poder reportar más casos debido a la disponibilidad de estas pruebas. Hoy, tristemente, reportamos 8 muertes por la COVID-19 en la ciudad. Hay un total de 1.243 personas que han muerto por la COVID-19. 662 o el 53% de estas muertes han sido en hogares de ancianos. Les recordamos que este virus no discrimina por raza o por género. Les informamos que hasta ayer por la tarde 439 personas han sido hospitalizadas en Filadelfia y 891 personas en la región sureste de Pensilvania. La tendencia nos demuestra un claro descenso en las hospitalizaciones. Las pruebas ahora se encuentran disponibles en casi 50 centros ubicados a lo largo y ancho de la ciudad de Filadelfia. Puede usted ubicar el centro más cercano a su domicilio visitando fila.gov/testing. Les recordamos que las pruebas están disponibles con cita previa. Y les alentamos a todas las personas de cualquier edad que tengan fiebre o problemas respiratorios a realizarse la prueba del COVID-19. Si usted ha estado en contacto con un caso del COVID-19 confirmado o sospechoso, le exhortamos a realizarse esta prueba. Estamos ya muy cerca de la reapertura de nuestra hermosa ciudad. El 5 de junio pasaremos a la fase amarilla. El retorno a la normalidad, sin embargo, involucrará muchos cambios. Hay que reducir el número de personas dentro de los establecimientos. Tenemos que acostumbrarnos a observar barreras de plexiglas en las cajas de los supermercados y en espacios donde se atienden a una gran cantidad de personas. Hay que seguir manteniendo y respetando la distancia social. Y tenemos que normalizar el uso de la mascarilla o cubierta facial al salir de casa. Hay que recordar que mi máscara te protege a ti, tu máscara me protege a mí. Así es que a usarla, porque solamente juntos podremos superar este gran reto. Muchas gracias.
Thank you, Armando. We will now move to our Q&A portion for members of the media. Please remember we do have limited time during these briefings, so only one representative from each media outlet is permitted to ask questions. Reporters are asked to limit their questions to 3 or fewer, and we will do a second round of questions if time permits. For those logged in today, please use the raise your hand feature. It can be found under the participants list. We also ask that you use video to ask your question if you are able for broadcasting purposes. We will now unmute reporters one by one to ask your questions, and we will start with Shaira Arias from Telemundo 62.
Hola Armando.
Buenas tardes, Jaira.
Buenas tardes. La primera pregunta es sobre lo que se llevó a cabo en el día de hoy en el aeropuerto. ¿Cuántas personas desplazadas, vulnerables, fueron sacadas del aeropuerto? ¿A dónde fueron llevadas? ¿Y fueron ellos todos examinados por el COVID-19?
The question today has to deal with what took place today at the airport. I would like to know how many homeless people were removed. Were they tested before they were sent elsewhere, and where were they sent?
So we will have to get back to you on final numbers. Somewhere between 20 and 30 people who were relocated. Everyone who was placed in a shelter or housing facility was tested. But I don't have the breakdown of where everybody went after those tests were provided.
Tendría que darte la confirmación de los casos por número exacto más adelante, pero sabemos que de 20 a 30 personas han sido reubicadas en albergues o en residencias temporales. Todas ellas han sido sometidas a la prueba del COVID-19, pero no sabría exactamente cuáles han sido las que han ido a uno o al otro lugar.
Ok, gracias. La siguiente pregunta es sobre el evento que se llevó a cabo anoche, donde hubieron entre 200 a 300 personas aglomeradas llevando a cabo una fiesta en Cecil Moore y la calle 28. ¿Cuál es el plan de la ciudad debido a que posiblemente se pueden llevar a cabo otros eventos de esta manera en el medio de esta pandemia donde las personas no tenían la máscara puesta, no estaban llevando a cabo el distanciamiento social, la temperatura está aumentando, entonces hay posibilidad de que estos jóvenes, quienes no estaban yendo a la escuela todo este tiempo, van a seguir llevando a cabo este tipo de fiesta? ¿Cuál es el plan de ellos?
Una pregunta, Shaira, ¿y este evento que refieres anoche fue una fiesta oficial o fue una reunión extraoficial?
Todo el mundo se comunicó, parece, por redes sociales y ellos llegaron, no fue una fiesta oficial, no. Eso fue completamente non-official y ellos se reunieron allí, entre 200 y 300 personas.
Bien, I would like to ask in regards to what took place last night. There was an informal meeting that was advertised through social media for young people where 200 to 300 people gather up around Cecil B. DeMore and 28th Street. This event, in the midst of a pandemic, showed that the people were not wearing their masks, were not keeping social distances. And as temperatures go up and young people are not in school, what is the city thinking to do about preventing any more of these events from taking place?
Well, we'll continue to do our educational outreach, but you saw all over the country yesterday and this weekend, people gathering at lakes in the center of the country, people, not socially distancing, not wearing masks. We have to continue to talk to people and communicate with people that this is their responsibility to keep this going in the yellow, the green direction, as opposed to in the yellow into the red and staying in the red. It's difficult with a large group of 200 plus people to make a mass arrest, and that's not something that we're interested in doing, and would cause a severe strain on our police department to do something like that. We will continue hope to be able to reason with people. There's going to be folks in our society that are going to ignore it, and they're going to do what they want to do. We got to try to break up these things the best we can without putting police in harm's way or creating any kind of disturbance. I don't have a magic, magic theory or magic answer to your question. It's just that we got to continue to talk to people and make sure that they understand that every time they do something irresponsible, they're putting themselves and their families in jeopardy. We're going to continue pounding away at that message.
Bien, nosotros tenemos que continuar con nuestros esfuerzos de educación continuadamente. Se ha visto este fin de semana alrededor del país de que la gente se ha estado reuniendo en los lagos sin observar el distanciamiento social y utilizar mascarillas. Lo único que podemos hacer es seguir hablando, comunicándonos con ellos para poder pasar de la fase amarilla a la fase verde en vez de pasar de la fase amarilla a la fase roja nuevamente. Tratar de controlar una masa de 200 a 300 jóvenes. Nosotros no estamos pensando en hacer arrestos en masa. Tenemos que trabajar con la policía y hacer que la gente razone y utilice su buen juicio para poder portarse bien. Sin embargo, va a haber gente que va a ignorar esto y va a seguir continuando estas conductas que no nos van a ayudar. Nosotros vamos a tratar de poder, fuerza policial para impedir de que estas reuniones se den en su lugar y vamos a continuar nosotros intentando llegar a ellos en su sentido común. No hay una teoría mágica ni una bala mágica que llegue a resolver este problema, así es que vamos a continuar hablando y vamos a continuar ilustrándolos para que tengan responsabilidad y no poner en peligro a sus seres queridos y a sus familias. Gracias.
Y por último, Armando, yo estuve allí ahora y varios de ellos estaban diciendo que posiblemente van a tener otra fiesta esta noche. ¿Hay una posibilidad de que la policía va a estar patrullando allí hoy o en esta semana? No sé.
My follow-up question has to do with the fact that I was there myself last night and I went...
Ahora.
Oh, hoy día, today, and people are planning to have another party for tonight. Is it possible that the city would be patrolling the area in order to impede this?
Yes, it's very possible. If we have advanced information and intelligence that something's going to happen, we try to get ahead of it and get our people in place strategically so they can keep it from happening or limit the amount of time that it's going on. I mean, this is not an easy answer question. I mean, you're talking about people who are gathering. Physical force is not the answer to this, and we're not going to go in that direction. But doing what we can to inform people, to educate people, and to get people to cooperate. And if you've seen, it's not only Philadelphia; it was around the entire country, in the Midwest, in other places in the country. People are acting irresponsible, and we're going to do our best to give them some responsibility.
Bien, si nosotros contamos con información previa, podemos desplegar nuestras fuerzas para tratar de impedirlo. Si se tiene información, por supuesto, tenemos que actuar de una forma estratégica. Nosotros no podemos resolver esto muy fácilmente porque no es algo fácil. Si hay estas reuniones, tenemos que tratar de impedir que se den sin utilizar la fuerza física y arrestar a las personas. Vamos a hacer lo que podamos. Y si alguien tiene información respecto a estas reuniones, pues que nos las pase para poder tomar medidas preventivas al respecto. Se ha visto alrededor del país, en el medio oeste sobre todo, a gente que está haciendo esto en todos los lugares. Sin embargo, es muy difícil de cambiar la conducta de la gente y vamos a hacer lo que podamos, siempre y cuando tengamos esa información disponible. Gracias.
Thank you. Gracias, Armando.
A ti, Shaire.
Thank you. We are going to move to Mitch Blocker now with NBC 10. Mitch?
Good afternoon. I'm hoping I can get a thought from the mayor and from Dr. Farley. I'm curious how new information has shaped, one, your medical advice and then your policy. New information both in terms of how the virus behaves and also where cases cluster. Dr. Farley, I'm curious, how has that shaped your medical advice? And Mr. Mayor, how has that shaped your policy evolution and decision?
Not sure I fully understand the question, and we certainly we track the epidemiology of this virus, where it's going, what populations it's in, what's happening in other jurisdictions, and try to base our policies on that as much as possible. If other jurisdictions are succeeding in allowing certain activities, for example, and the virus has not shown increased activity, that's a sign that we could probably safely go there ourselves. Is that getting at your question?
That's absolutely, yes, you absolutely followed. Yep.
And on our end of it, basically, people are getting mixed messages. You hear from the President of the United States, it's all over, go out, it's magically going to go away. You have people who are protesting at Capitol steps, at state capitals throughout the country. and in Harrisburg too. You have Pennsylvania counties that are lower impacted by the COVID and want to open up sooner than others. So we're balancing, our regional partners and other counties in the state as to the direction they're going in. There's nothing more than I would want to go to yellow and then go to green on schedule. But the frustration about this is that when you see 250 people at 28th and Cecil B. Moore, or 2,000 people in a pool in St. Louis, by a lake without masks on, the possibility of us getting where we need to be or want to be in a timely manner gets continually diminished. And it's frustrating. And I don't have an answer for when people misbehave, other than continue to keep on talking about it, promulgating the information, and hoping that we can continue our downward trend and then get back to some sense of normalcy. But I will tell you, normalcy in another year or two is going to be this mask, I think, and we'll see where it goes. But I don't have a crystal ball.
Mayor, I'm curious also, as the governor gave his remarks and talked about lifting the stay-at-home order by June 5th statewide, you have been remarkably consistent about since early March about stay-at-home orders and what you want to see happen and what people need to do in order to stay safe. The governor also has done that as well. He's been conservative about how to allow people to be out in public. Is it difficult politically? Is it difficult to make that argument to people now that maybe we can be a little less restrictive?
Again, Dr. Farley deals in science and we deal in like art. I mean, it's not as scientific on the political side, because again, you have all those other factors. You have the president of the United States on every single day acting like nothing's going on. You have a governor who's responsible, who works with us, who tries to, balance all the issues he has to balance. But he also has sometimes a cranky legislature that represents parts of the state that aren't impacted by this and they want to get open. So he's got a hard job, as I do, but I mean, he's got the whole state and he has the authority to lift or to keep in place the stay-at-home order. And that's why he's governor. So we'll attempt to continue to work with our regional partners and with the governor's office to do our best. And hopefully we can move towards the June 5th deadline and then the other goals that have been set for further opening.
The governor said that he hopes to meet that June 5th deadline. Has he told you that he's committed to that date? What has he told you?
He's told me that we need to continue to work together and to make sensible decisions based on the information at hand. And that's the date he set. If we're not, Dr. Farley will tell us very clearly if we're going the wrong direction, and then we'll have continued conversations about what happens in Philadelphia County or Montgomery County or Delaware County. I mean, it's difficult.
Thank you, sir.
Thanks, Mitch. We're going to go now to Geoff Cole with Fox 29.
Yeah, hi. I'm sorry, real quickly for Dr. Farley.
Oh.
Dr. Farley, you've obviously said that in a few days you're going to add guidance. You're going to put guidance out there regarding the move to the yellow phase on the 5th. I was interested in what you said in there. You're going to advise businesses about the number of people that they can have. Are you fully comfortable that a government that will now have a role limiting or at least advising businesses as to how many people they can actually have employed and in their facility as they try to get back to work here?
Well, nobody's totally comfortable with anything we're doing right here. What we're trying to do is balance fighting this epidemic on the one hand with the economic damage of not allowing activities. And I think that balance really does depend on business enforcing certain restrictions that would prevent the spread of the infection. And so we're going to be giving guidance as to how to do that. My sense is that businesses are very eager to open and very willing to take steps that allow them to open in a safe manner. They feel that they need to do that for their customers anyway. And so they're looking forward to that guidance. So everything here we're doing with some uncertainty to it, but I do think this is the right step.
Are you going to try to go beyond science and look at economic activity to try to sort of a guide a business based on how many people they need, as opposed to, you know, what you'll see as too many folks inside an office space?
Well, you know, I'm not an economist. I'm not a businessman. I can't speak to that. However, I do know that if there's no economic activity, that there's a real health consequence to that. And so I do understand the basic principle that we need to get our economy restarted for if no for other reason than for the health impact of that, and that does lead to certain restrictions on how people can operate. Those restrictions, there's certain uncertainties. I'm sure around the country there'll be slightly different restrictions, but every place is going to be doing the same sort of balancing act. And the key to it is a barrier, so that the droplets that have this virus don't spread from one person to another. So that involves masks, involves physical barriers, and involves spacing. And then for the mayor, will you react to the demonstration? The city employees believe they're going to be laid off or know that they're going to be laid off. Had a demonstration or will demonstrate today. Can you speak to their concerns and what we're now seeing in terms of public activity around this?
I mean, one of the saddest things we've had to do is lay people off. But based on the reality of our economic situation, that had to happen. And we tried to minimize the impact as best we could. We have resources available for employees that are being laid off to try to get them in a portal for them to work through so that they can look for work, making sure we give them the right advice on their unemployment benefits and whatever's available from the state or the federal government. No one likes to lay anybody off. And certainly I'm one who felt very bad about having to do all that. But we're trying to balance our books. We can't run a deficit. We have to have a balanced budget and a balanced 5-year plan. And some of the suggestions that some other elected officials are throwing out there in our budget would result in even more layoffs because of our contractual situations with our employees, which would wind up having to lay off police and firefighters, which I'm not interested in doing.
Thank you.
Thanks, Geoff. We are going to move now to Denise Clay with the Philadelphia Sunday Sun. Denise.
Okay, now I'm unmuted. Hi. I guess my question is, now that, you know, we're talking about opening up and we're seeing that, let's face it, you've got people who are pretty dedicated to not following the rules here. Is there a plan B that you're going to be thinking of in case we do end up having another increase in cases and hospitalizations and stuff? Because like I said, you have some people who are pretty dedicated to not following the rules.
Well, they're dedicated to putting us back in the red state as opposed to yellow. I mean, again, God forbid, and I'm saying this with all prayerfulness, that even though these folks are doing what they're doing, that we can continue to drive down these numbers and get back into some normal rhythm. But if we don't get there, it's going to be their fault. And I mean, I can't, make everybody think clearly. And we're doing our best, and hopefully we are moving in the right direction. Hopefully we'll continue to do so. But again, for every one of these incidents that you see with large numbers of people just flaunting the reality, we could possibly wind up back in the red again, which is no one wants to be.
Well, that's it for me.
Okay.
Thanks, Denise. We're going to go now to Howard Monroe with CBS 3.
Yes, good afternoon. This is for the mayor and also for Brian Abernathy. This morning, City Commissioner Lisa Deely was asked about her budget regarding the increase in cost of paper ballots. She said, we're in danger of not being able to run the November election. What's your response to that, and what can be done to address it? You mentioned that today was the deadline to apply for that mail-in ballot for the primary. What about November?
We're still working with the commissioner's office. We've been working constantly with them since this whole thing started. And I think we'll the sum resolution. We will have an election both on June 2nd and in November. And the budget process is proceeding, and we'll see how it turns out in the end, but we're not canceling the elections.
All right. I also have another question regarding people wearing masks. It's clear that some people are choosing to not wear masks when they're out in public. I believe it's still required when they go into any of these stores that, to pick up an item. However, when you mentioned that we are nearing a new normal, it was actually the health commissioner who said we're nearing a new normal. Is there any concern that people not wearing masks will impact the reopening that you guys are planning for now?
Absolutely. I mean, we've been saying this now for ad nauseum. I mean, it's you have to be responsible. You need to be mature. I mean, and despite the fact that the leader of our country is telling people it's not wearing a mask, nor is the vice president wearing a mask, and telling people it's not needed, it's swimming upstream. It's hard. So people who don't want to wear a mask and be responsible are reinforced by the president's scramblings. And we're trying, I think the majority of the people, however, are following the rules and following reasonable procedures during the course of their day. So I don't know the answer to the question, but as Governor Murphy put it, if there are more knuckleheads than normal people, we'll be back in red by October.
If I could just add in this, in as much as we do see people out there who are not wearing masks, I feel like we're making progress. Just into my own eyes, I feel like I see more people outside wearing masks now than I did, say, 2 or 3 weeks ago. Also, I feel quite comfortable that in most grocery stores where people are going in now, they're wearing masks. And so that's something, it's a place where that the masking can be enforced. And as more businesses are opening up, they're also going to be asked to enforce that. And so we're asking for a big change from people to not ever having used a mask in the past and using it in the future. But I do think we're making progress towards that. And I'm optimistic we'll be able to continue to make progress. And we're going to continue to hammer home the messages around that, about how important that is for everybody who very much wants to get the economy restarted.
And lastly, regarding large gatherings around the city, you know, this issue from last night on CCB Moore has been repeated in other areas that are not in the northern part of the city, including in Rittenhouse Square, along the Schuylkill River Trail, at the Art Museum. Is the responsibility to get us to the green phase on everyone, not just from what you saw last night in a certain neighborhood up there?
We live in a society. We live in a community. If some people in the community don't want to be responsible, then they're going to be responsible for the death of senior citizens, the slide back into red if it happens. And I agree, it's in various parts of the city. And it seems to make no common sense to me why you can't be out with a mask on your face. I still can't understand why that's such a burden. And I've said this before, just as we passed Memorial Day weekend, and I think of the people who served in the military during World War II and the things they were asked to do, not for 2 months, but for 2, 3, 4 years. Digging foxholes in the French forest and things that were happening during the course of that war. And it saddens me that too many people are not responsible enough to make a simple sacrifice.
Thank you.
Thank you, Howard. We're going to go now to Jack Tomczyk with Metro.
Hello, this question's for the mayor, following up on Geoff Cole's question about the protest outside City Hall. So those protesters were city workers, and they were calling on your administration to raise revenue sources by raising taxes on businesses, big businesses, and wealthy individuals. I just wanted to see what your response was to those specific.
First of all, we're not allowed to do that. We have a uniformity clause where we have to tax everyone equally. So we can't tax wealthy people more at a higher rate than we tax, regular working people. We think that this budget the new budget that we've reintroduced is enough of a balance between raising revenues from certain segments and also layoffs and the like. And we think that what we've done is a balanced budget, and we're hoping to get the support. We're sorry that people had to be laid off. We'd like to get people back as soon as possible, and the sooner we get the economy back in shape, the sooner we can look to bring people back. But I don't have an answer.
And for Bryan Abernathy, I know I asked about this last week, but I just wanted to, since I'm on the topic again, is there any, do you have a total number of people who are going to be laid off June 1st, or do you have a department breakdown?
We're going to be providing that to City Council, and we'll certainly provide it to you all after we provide it to Council.
Okay. And then last question, this is either for the mayor or for the health commissioner. Will the yellow phase look different in Philadelphia than it has in the state's other counties that have already gone to yellow?
If you know.
I would just say it may, we're going to look at it and see. We want to make sure that we have the protections in place for Philadelphia, which is clearly unique in the state of Pennsylvania.
Thank you.
Thank you, Jack. We're going to move now to Max Marion of Billy Penn.
Hi, everybody. Good afternoon. This question's for Bryan concerning the universal testing at the city jails. Are the results going to be released piecemeal day by day as those results come in, or are they going to be released in a sort of lump fashion after the 2-week testing period is over?
We'll release the results when the testing period is over, hopefully either this week or early next.
So how does that impact the numbers that you're releasing every day, which have been consistently zero for, since this was announced?
So those zero test results are really around symptomatic patients. So we haven't tested any symptomatic patients that have come back positive, and then the universal testing numbers have not been included in those numbers.
Okay, and are people who test positive being transferred to the alternative and special detention unit?
It depends. Is the complicated answer. So depending on where people are tested and the number of positive results within a unit, people may be cohorted. In other words, an entire wing of a certain facility may become a COVID positive wing. But again, we'll be able to provide more details with that on those precautions when we release all the test results.
Okay, so is the ASD being reserved for any special type of a person at this point in the city jail?
So the ASD is still an isolation wing, and so there are still some facilities within the jails that we're not able to cohort, like I just described. They don't have wings that we can easily separate out individuals, and so we couldn't keep everyone who tested positive for COVID in one facility and cohort. So those people are being transferred to the ASD.
So everybody at ASD, just so I'm completely clear, has tested positive or been exposed?
That's my understanding. If my understanding is incorrect, we'll certainly get back to you.
Okay. Well, as far as my understanding is that the census at that facility is about 92 people as of today. I'm just curious how that squares with the numbers, considering there's only 2 active cases right now.
And Max, that's a level of detail I'll have to get back to you. Again, ASD is multiple facilities within the or has multiple rooms, so it's not like everybody is in one place. So we do have a mod in ASD of about 100, I believe, that was set aside for isolation space.
And Max, we're going to have to move on, but if you have additional questions, please let us know. We're going to go to A.D. Amorosi of Philadelphia Weekly now.
Yes, good morning. This is for the mayor. I am curious whether, with the potential move into yellow, are you prepared to open City Hall, LNI, the municipal buildings? Are you planning to, are you planning to open back up soon? Are you hoping to open back up?
There have been Bryan can fill you in on details, but there have been ongoing conversations with the chief administrator for the city and some of the department heads, trying to kind of rank departments as to which need to be put in place, what people can work at home, what people need to come in. All that analysis has been ongoing. And Bryan, you could probably give more details if you're.
Sure, and thanks, Mayor. I actually think you did a pretty good job. We've been working over the last week or a few weeks to prioritize what departments need to be up and operating when. So certainly those regulatory departments to regulate construction and provide support for other activities and other business activities. Not very articulate on my part. And then revenue functions, and then certainly bill paying functions, making sure that checks get released to our vendors. So we're prioritizing those functions. We're still also trying to get as many people to work from home as possible and upgrading our technology as appropriate. And then making space changes as necessary. And so whether that's plexiglass in front of with our security guards, or creating some plexiglass guards, but in the concourse to protect our workers, making sure individuals are masked. So all of that to say, there will be portions of the quadplex that are open come June 5th. It will not be open in its entirety, and we'll ask you all to look for some additional guidance on what exactly is open and kind of what is our public posture with allowing the public into those buildings.
So then it's fair to say that everything from taxes to jury service to sheriff sales won't necessarily be ready to go by June 5th.
Not everything will be open by June 5th. Again, our core services, we do expect to be open by June 5th, but not all services.
Okay. My second question is about the Office of Arts and Culture. I'm going to have to guess this is for the mayor. I'm curious, City Council drew up some notes last week. I'm curious as to where you think you are leaning toward the total elimination of the office.
Well, look, we have, on one hand, I got people complaining that we're raising revenue we shouldn't be raising, and on the other hand, I got people complaining that we shouldn't cut. This is a difficult situation. There's never been a situation like this in my lifetime, certainly in anybody else's lifetime here, and we don't have a playbook to manage this by.
Sure.
Certain things had to be eliminated. Hopefully, at some point in time, we can bring them back. And as I said before, with the budget that we sent to the City Council, it's certainly a work in progress. But anybody who wants something changed has to make sure that the budget balances, that it makes sense long term, and it doesn't affect any other core operations of the city. We didn't want to lay people off, and we didn't want to eliminate a lot of the arts and culture issues. But I don't know what else to say other than we have a $650 million hole. $650 million. That's 6 times higher than the 2008 recession hole. So I mean, I feel terrible about it, and we'll try to get it back as the economy improves. But in the meantime, those are the decisions that we made. And if council wants to change that, then they need to show how they're going to change it responsibly and make the budget balance.
Thank you so much.
Thanks, AD. We're going to move now to Claudio Lauer with the Associated Press.
Hey, how are you today? I have a couple of questions. The first, I think, is for Dr. Farley. I'm not sure if you have it, but during the briefing today from Governor Murphy's office in New Jersey, he had mentioned the state is now looking at folks who are putting off immunizing their children as well. I was wondering if Philadelphia had any updated numbers regarding that issue.
I don't have updated numbers, but I can tell you that we are very much worried about this because pediatric clinics haven't necessarily been open. Parents have not been bringing their children, and our children are getting behind. We certainly don't want to have a measles outbreak. And so we want to try to get those offices open as much as possible and get parents bringing their children in, particularly the young ones under the age of 2, to get them up to date on their immunizations.
Okay. Is there a way at some point to get those numbers or any updated numbers from your office?
We'll see if we can get to you.
Okay. My second question is, I think it's for Bryan, but so Pennsylvania was talking about the Department of Corrections, what they're going to be doing to phase out restrictions, including the 23 in cell isolated restrictions for prisoners. And I was wondering if in any of these talks for reopening, there have been conversations about what restrictions are going to remain in the Philadelphia jails.
So we're not at that point yet. I think we want to see how the universal testing goes, and then we will be able to have a conversation about what restrictions we can lift or not. I think as an aside, we are still very concerned about congregated care facilities, which the prisons is certainly one. And we'll probably have the most restrictive guidelines for those facilities of any others in the city. But we'll certainly be looking at that as test results come back.
Got it. Thank you so much.
Thanks, Claudia. Now we're going to go to Laura McChrystal with the Inquirer.
Hi. First, I have a question about the guidance on walk-up ordering for food. The mention of mobile dining, does that refer to food trucks? And are those permitted to resume operations now with walk-up orders?
Yes.
Okay, thank you. And a question for the mayor. I know you were asked already about Commissioner Lisa Deely's statement this morning that there is not enough money in the budget to run the November election. I know you said you're still working with her office on that, but do you agree or do you disagree that as is there's not enough money for the November election?
I agree that that is her position, and the budget is again an ongoing process, and we'll continue working with departments, individual departments, and city departments to get where we need to be. But we still have ways to go in trying to figure that out. But there will be an election in June and in November.
Okay. But when that amount was set in the budget, in your proposed budget, did you believe that it was enough for a November election?
Yes, or we wouldn't have suggested it.
And Laura, I also want to make a point that there are federal and state resources that we also think should be coming into not just our elections commissioners, but all election boards across the country.
Okay, thank you.
Thanks, Laura. We're going to go to Madison Sidechick with Temple Update.
Hi there. So my first question is, at polling places, will people be provided with any PPE like gloves and masks if they don't have any?
Brian, you have it?
So yes, they will be provided some PPE. I don't have the details of what that PPE is on me. We'll see if we can't get that back to you sometime later today.
But there's going to be less polling places and longer lines if you vote by mail. It's the easiest. First I've ever voted by mail. It is the easiest thing to do. You can. It comes. You open it up. It's very understandable. You sign it. You put it in a special envelope, and off it goes. And I just got an email this morning saying that they've received it, and my ballot will be counted.
So do you think that people are going to be discouraged to vote if they're unable to get their mail-in ballots turned in on time?
I hope not, but again, this is the responsibility of citizens in a democratic society is to vote, and we will make it as easy as possible based on the conditions we're in. But we don't have enough people voting by percentages before the pandemic, let alone after. And we're going to do our best to get everybody's vote counted. It's going to be critical for November.
My last question, with as you said before, with a fraction of the amount of sites being open for the primary, can you tell me how you feel, if you're concerned or not, about there being crowding around polling places? And
well, I mean, yeah, we are concerned about that, and we're going to try to maintain social distancing. We'll probably, I would assume, set up these stickers that have been on the ground 6 feet apart, so people know. If you've seen them in supermarkets and in Reading Terminal Market and other places where people need to stand on those spots to keep 6 feet apart. Yeah, I mean, it's not going to be fun, but it has to happen.
Thank you so much.
Thanks, Madison. We're going to go now to Kennedy Rose of the Philadelphia Business Journal.
Hi, everyone. I know you said dine-in service is prohibited with today's expansion of restaurant services, but has the city looked any further into having outdoor seating as an option for restaurants?
Doctor?
I think that's so. Kennedy, we are looking at that. So we're our Office of Transportation and Infrastructure is working with L&I, Health and Commerce Department to look at those issues to see if we can provide additional curb space, additional sidewalk space, or lane, or closing streets to provide that help. But I don't have an announcement yet on what exactly that will look like. We want to make sure we're thoughtful about whatever we do.
Okay, thanks very much. That's all I had.
Thanks.
Thanks, Kennedy. Now we're going to go to Bryan McCrone with NBC 10 Digital.
Hello there. Thank you. A question about the homeless at the airport. I really, since you answered it earlier, I was just curious about if you could provide an update. It sounds like you didn't know if they went to any of the hotels that you had. I think you had 3 hotels back in April 15th. You talked about Fairfield Inn, Springfield Hill Suites, and the Holiday Inn Express. Those 3, I think, were the 3 that you guys had, right? And whether or not you know if they went there or somewhere else, I was also hoping maybe if you had an update on the use of those hotels and if the leases are still going on and how just could you give an update on those 3?
Sure.
Brian, please.
Yep. So the Holiday Inn Express is primarily an isolation site where people who have tested positive have been placed for quarantine for isolation. There's a COVID prevention site on which is the second hotel in Center City, and it is primarily being used for those sensitive populations in our shelters and congregate care facilities. The Spring Hill that lease is being terminated, and then there are also some folks that would have returned to Delaware County, and also that may have entered into congregate care facilities if they were of an appropriate age and hadn't tested positive as well. We're also looking at additional sites, recognizing that the airport is one issue, but we still have issues at SEPTA in Kensington and in Center City. So we still have issues that we need to address.
Okay. If you have this on in front of you right now, or if maybe you can get it for me, but have you kept track of how many people went into those? The Holiday Inn was, like you said, the isolation quarantine for the frontline workers. It'd be great to see what kind of use that got, and if there are any people still there. And then for the other 2, whether or not they were needed, and just like a history of how many people were there.
Sure. So I will say that on average, I'll have to get back to you. I can tell you on average, I would be making round estimates. So we'll get back to you on specific numbers.
Okay. Sounds good. And then just the construction topic that was brought up earlier, just a little, it seemed like, so construction is allowed across the city again. Is there any more detail about that? Just wanted to see if you could flesh that out a little bit for me.
Not sure what you mean. So yes, so construction is, and it's not all construction. We're still finalizing all of our regulatory review panels, but we're trying to open up construction as much as possible, and that's what the executive order did today. So we have made progress in some of those regulatory reviews, and courts are certainly beginning to open. But I'm not sure what you're trying to get at.
Well, that's what I was just wondering. Like construction, meaning like is basically all construction now allowed? But no, you're saying it's more detailed than that.
So it is more nuanced than that, because the construction industry is complicated. But I think we are. Why don't you take a look at the executive order, and then if you have questions, you can certainly circle back and answer them.
Okay.
Thanks.
Thanks, Brian and Brian. That will conclude our briefing for today, and we will see everyone back here tomorrow at 1 p.m. Thank you.